welcome to those are with us here today. We have few people. I hope that some more will join in the course of the webinar. Let's see how things are going. But I'm very happy that you're here with us. Yeah, my name is Tineke Hooijmans. I'm Associate Professor of Sanitary Engineering, and I'll give an introduction to the Graduate Professional Diploma Programme in Humanitarian WASH. So this webinar that we have is in the context of this program. And I'm pleased to also show here Claire Furlong, who is the keynote speaker with us, and she will update you on public health and WASH in humanitarian context. The content of today will be, I will first explain a bit about the Graduate Professional Diploma Programme. So what was the development, what is the content, how can you register? And then I will introduce you to the IHE staff involved. And after that, Claire will give a keynote lecture titled Public Health and WASH in Humanitarian Context. And then there is room for questions and answers. You can also put your questions in the chat, and during the presentation, we will try to answer those. And we also have time afterwards to answer some of the questions. Oh, gosh. It's so strange. Now, this is a live webinar, so things like this happens. So everything started with the cooperation between IHE and UNICEF. So as you might know, UNICEF is the lead of the Global WASH Cluster, and the Global WASH Cluster developed a roadmap 2020-2025, and they expressed the need to strengthen the capacity of the humanitarian WASH sector, with the aim to have a consolidated, predictable pool of competent and skilled WASH professionals that can be mobilized to respond in emergencies. So that led to the development of the Graduate Professional Diploma Programme, GPDP, in Humanitarian WASH. And from now on, I will just say GPDP. So I hope you know now where it stands for. So the development of the GPD was as follows. First, the Global WASH Cluster did a mapping of the offer and demand worldwide with respect to humanitarian WASH. So they identified a few areas that needed more attention and more capacity building. Then, together with UNICEF, we identified co-developers. We developed the courses. We reviewed the courses with the humanitarian sector. We launched and implemented the first run in 2021. And after the first one, we did a thorough evaluation to see what could be improved with respect to delivery and content. And here you can also see on this slide the humanitarian and other partners who were involved in the development of the courses. So now the 4 courses that I'm talking about that form the GPDP are governance in humanitarian context, and that one will start this May 6th. We have then the second one is the public and environmental health in emergencies. That one will start October 6th this year. The third course is water and sanitation in urban humanitarian context, which starts in March next year. And then we have building resilient systems in fragile context, and that starts in July 2026. So the idea is that you follow 4 courses in sequence, start with the first one. But I can imagine that you might be interested in only 1 or 2 courses maybe, and you can also follow them as just standalone courses. And then just to mention that water and sanitation, so course number 3 and number 4 also will start this year, but that is from the run that started the GPDP the previous year. So maybe that's a bit complicated. If we have some questions, we can explain it more in detail. You can find more information about the courses on this specific website. You see the link here. And on the website, you also will find some detailed information and some testimonials of students who took the courses before and are now working in the humanitarian sector. So the targets of these courses are WASH and or humanitarian professionals in their early or mid-career who will take on coordination or technical leadership roles. So the level is academic. It's not vocational training, it's academic level. And because of that, we also please realize that the academic admission is open to applicants who can provide evidence of having a university bachelor degree in an appropriate field of study for your program. If you think you have an appropriate field, you can reach out to us and we can confirm, and we will judge your background and see if you're eligible to be admitted to the courses. The structure are, like explained before, there are 4 online courses, and you also get European credits. That is 5 per course, and the total number of study hours is estimated to be 560. And between the 4 courses, there is 1 month for you to, to recover a bit of the intensity of the courses and to be fresh to start a new course. So that means because of the duration of the course, per course it's about 16 weeks, you need 20 months to complete the 4 courses. So therefore the courses go from 1 year to the other year. Nice of these courses, it's not like a MOOC, so there will be guidance for the topics and the assignments. There will be live sessions about once a month. And there is also a detailed communication and guidance on the deadlines. There will be follow-up on progress. You will get feedback. So it's really a course that is moderated by the course leader. Here you can see the 4 courses. So we have the course here. The first one is the Governance Humanitarian Context. And you can see here the humanitarian partners that were involved in the development of the content. So for the governments, it's UNICEF, Oxfam, and SI, Solidarité Internationale. For environmental and public health and emergencies, it was CDC, MSF, UNICEF, IFRC, Oxfam, ASB, a German aid organization, Sphere, and Humanitarian International. For water and sanitation and urban humanitarian context, we have ICRC, SI, and WHO. And for building resilient system in fragile context, we have the German WASH network, ICRC, Oxfam, and UNICEF. So as you see, the courses are not only academic, but they're really embedded and learning from the humanitarian sector, as those people were involved in developing the content together with us. Beside those 4 courses, we also have a course or cross-cutting page, a main page, and that addresses cross-cutting issues that are at the forefront, should be at the forefront of the humanitarians, which is localization, inclusive response, accountability to affected population, gender, and protection. Now, here you can see the staff involved. So for the first course, Online Governance in Humanitarian Context, we have Gabriella. Gabriella is currently teaching, so she is not with us in this webinar. But you see here her picture. Then we have Claire. So Claire will give the webinar today, but she's also the coordinator of the online course in public and environmental health and emergencies. Claire, you're with us. Can you say something?
Hello, everybody. I think I look very different compared to my picture. I've got different coloured hair and different lengthed hair, so I've had it cut and coloured. So the course that I run or coordinate is Public and Environmental Health in Emergencies. And this course is very interactive with a lot of activities. And there's a very large case study that runs throughout this course, which is the assignment. So you're working with a real life case. And the kinds of topics and subjects that we cover is things like public health and WASH, water-related diseases, communicable disease theory, epidemiology, decision-making, WASH interventions and approaches, and also WASH in healthcare facilities. So it's quite a large module. It's very interdisciplinary, but there is quite a lot of public health focus to it. Thank you.
Okay, thank you very much, Claire, for this explanation on this course. Then the third course is Water and Sanitation in Urban Humanitarian Context. And we also have Shiris with us. I would like to give the floor to Shiris.
Thank you, Tineke. Good morning, good afternoon, based on the geographical region that you are. My name is Siddhi Singh, and I'm a senior lecturer at IHE Delft, and I coordinate the third course, that is Water and Sanitation in Urban Humanitarian Contexts. In this course, we broadly delve into three main topics. First, to look at the urban context and how it is different from the rural context, and what are the key challenges that you would encounter when you are working in the urban humanitarian context. Second topic, we focus more on technologies. We look at the systems approach of water supply, sanitation, and also look at the enabling environment, how to achieve sustainable water and sanitation services. And thirdly, it's more about the planning. And we look at a real case study from Freetown, Sierra Leone, and we try to develop a response plan for the urban context, looking at both the humanitarian and development needs. Thank you.
Thank you very much, Shiris. And then the fourth course we have as a coordinator, Akasuwa. The course is on building resilient systems in fragile context. I'm not sure if Akasuwa is with us. Akasuwa, I don't think you're here. Okay, probably she's also occupied in another activity. So, but she is the module coordinator. And another important person we have here, that is Titia, because she is the fellowship and admission officer. So when you reach out to IHE with some questions concerning the course, so more about logistics, cost, etc., the first person you will reach out to is Titia. Titia, maybe you can say a few words and introduce yourself. You're muted, Titia.
My name is Titia. If you apply for the program, the application will be reviewed by me, and I will inform you about the outcome, and everything that comes in between application and start of the first course is managed by me. So if you have questions about payments, for instance, then you can write me an email, and all other questions, and if I can't answer them, I will forward it to someone else. So really the period before you start the first course, you can ask me any question.
Okay, thank you very much, Titia. So I'm Tineke Hooijmans, and I'm the coordinator of this GPDP. Now, to give you an idea of your current participants, if you would enroll, this was the first batch, 2021, the first run that we did. We had then 28 students. We didn't have good gender balance. We only have 4 women. But it's nice to see that the participants came from different areas in the world and also from different employers. So we have here ICRC, IFRC, international NGOs, local NGOs, private companies, UNICEF, and also some people from university. And we had a nice balance. We had people from East and South Africa, from the global North, the Middle East, South and East Asia, and West and Central Africa. So people bring in their different perspectives and views and expertise also in the assignments, which is really very nice. This was my introductory presentation. So questions on registration, deadlines, content, cost, etc. can be put in the chat, but we can also answer some questions if you still have them after the presentation of Claire, so after the keynote lecture. So I would like to give the floor now to Claire. Claire, please.
Thank you, Tineke. I'm just going to take a few minutes to set up my presentation. Right. Ooh. Something's happened.
Hi.
Okay, can you confirm that you can see my presentation, because I can't really see it myself very clearly?
It's all good.
And can you
Yes.
hear me clearly?
Yeah.
Yes, we can.
Excellent. So welcome to this keynote on public health and WASH in humanitarian crises. So as Tineke said, I'm the course leader for environmental and public health in emergencies. And this course is very activity based, so we don't have many lectures or video lectures. So today I'm covering some of the basic concepts from the course. So I'll be exploring the link between public health and WASH, which is water, sanitation and hygiene in humanitarian crises. For those of you with a public health background, you'll be very familiar with this, but for those of you from civil engineering or environmental engineering, this might be new or not so obvious to you. So we're going to start right from the beginning. There are 3 different types of humanitarian crises: armed conflict, which is man-made; natural disasters such as geophysical disasters such as earthquakes and volcanic eruptions; hydrological disasters such as floods; climatological disasters such as drought; meteorological disasters; and biological disasters. So they're all grouped together under natural disasters. And then we also have complex emergencies. And this is a combination of both man-made crises and natural disasters. So the world is becoming more and more unstable. So this is a map that shows conflicts which are currently occurring. The number of conflict events has doubled in the last 5 years, from over 100,000 in 2020 to nearly 200,000 today. We can think about the current conflicts in Palestine and Ukraine and ongoing conflicts in Sudan, Mexico, Yemen, and the Sahel countries. Also, the number of natural disasters seems to be increasing. This is the number in 2023 compared to the average over the last 20 years. So the total number of in 2023 of natural disasters was above the 10-year average. And there seems to be an increase in climatic and weather-related disasters, such as mass movements. So that's kind of mass movements that are wet, so that's mudslides, storms and wildfires. And these are probably related to climate change. These events have resulted in over 86,000 deaths and affected about 9.3 million people. And it's caused an economic loss of about $200 billion. So this has led to a huge number of people being displaced within and outside of their countries. And this graph shows the number of people that have been displaced by man-made disasters. So in 2023, 117 million people were displaced. And from the graph, you can see this number is increasing every year. Most are displaced internally, so that's within their own country. But the UNHCR estimates that 6.6 billion people live in refugee camps. So they're displaced outside of their country and they live in camp settings. So both natural and man-made disasters impact WASH services. So natural disasters such as earthquakes, volcanic eruptions, storms, etc. These will only cause a humanitarian disaster if the population is vulnerable. And the WASH implications are that these kinds of disasters impact infrastructure, including WASH and roads. And roads are related to supply chains, so they're very important. With man-made crises, these are the political and armed conflicts. Many people are displaced internally and externally and need to be housed. So people absorbed in host communities may overburden the infrastructure and services, including WASH. People may be housed in camps which require WASH, and the lifespan of these camps can be highly variable. So the actual planning of the WASH facilities can be very difficult. In this slide, we got a number of 3 different types of crises that weren't mentioned before. So we've got fragile states, and this is when a government is unable or unwilling to meet the basic needs of the population due to weak governance and services. And this may develop into a humanitarian crisis. In this kind of under these conditions, basic WASH services are often neglected. We've also got protracted crises, and this is when you have recurrent disasters and conflicts. Under this kind of crises, the populations are acutely vulnerable, and again, basic WASH services are often neglected. And then we've got high-risk countries continuously affected by disasters. This is countries which may be vulnerable to climate change, and there's increased associated natural disasters. So in this case, existing WASH infrastructure may need adaptation, or more appropriate solutions may be needed. So during an emergency, it's common to see primary effects of disasters followed by a secondary effects. For instance, the primary effect of a mudslide might be that many people are injured and need urgent medical attention. A secondary effect might be that blocked sewers and broken water mains lead to an outbreak of fecal oral diseases some weeks later. This slide highlights the impact of natural disasters on WASH. If you look at water supply and wastewater disposal, you can see that most natural disasters could cause severe effects on the infrastructure here, but also it also impacts the supply chains because you've got damaged infrastructure, which includes roads. All natural disasters could also affect household sanitation due to the destruction of the structures here. You can see, oh, sorry, my little pointer's not working well there. Man-made disasters. In man-made disasters, WASH infrastructures can be targeted. This map and table is from a paper which is looking at using satellite images to detect damage to WASH infrastructures during the ongoing conflict in the Gaza Strip. You can see from the map, half of the water infrastructures have been damaged. That's the red dots compared to the blue dots. And in the table, you can see that damage ranges from infrastructures such as wells to water treatment plants. So what I've been talking about a lot about WASH and its destruction during humanitarian crises. But this presentation is about public health and WASH in humanitarian crisis. So how is WASH related to public health? So public health is defined as the science of protecting and improving the health of people and their communities. It looks at the cause of illnesses and preventative measures. It may come as a surprise to some of you that WASH is a critical component of public health because it helps prevent diseases, improves the quality of life, and supports overall well-being. So in the past, water and sanitary engineers were known as public health engineers as they improved the health of the communities where they worked. WASH is all about reducing environmental risks by providing safe sanitation and safe water supply. It protects us against communicable diseases, and it also improves the well-being and the economic status of communities, meaning that they're more resilient. So how does WASH protect us against communicable diseases? I'm sure many of you have seen the F diagram before, and this shows us how WASH is the primary barrier for fecal oral disease transmission. Fecal oral diseases are pathogens which are excreted in human and animal feces, and then these small particles of feces are ingested by us. So we basically eat them. hence fecal oral. You can see in the F diagram that good quality sanitation is a barrier for fecal material getting into the environment. This is indicated by the S's in the diagram here. So if we've got good sanitation, then we really don't get in contact with ours or other people's feces. Also, we need to wash our hands after defecation, and then we cannot transfer these small particles of fecal matter to others through our fingers, which then perhaps contaminates food, or we perhaps touch people. So fecal oral diseases are often spoken about, but what kinds of diseases are they? Common fecal oral diseases are listed in this table. On the top, you can see the types of microorganisms. This is important for control strategies. For example, bacterial infected water can be treated with chlorine, but chlorine is not effective against many protozoa, such as Giardia or Cryptosporidium species. In each cell of the table, you can see the disease name, which is at the top, and below it, you can see the name of the pathogen, and a pathogen is a disease-causing organism. I think we're familiar with many of these diseases, such as cholera, hepatitis, polio, typhoid, and perhaps diarrheal disease. So I mentioned diarrheal disease associated with E. coli, but many of these diseases are commonly known as diarrheal disease or cause diarrhea. The most common causes of diarrhea globally are Clostridium difficile, E. coli, norovirus, rotavirus, Cryptosporidium, and Giardia species. But why are diarrheal diseases important? Well, they're important because they're the third largest killer of children below the age of 5. They kill over 400,000 children per year, and the most common cause is water contaminated with fecal matter. This means that WASH is the main barrier to transmission. The situation is improving. The graph here shows that deaths due to diarrheal disease have dropped from above 2.6 million in 1990 to below 1.2 million in 2022, and the biggest drop was in those under the age of 5. And what this bar chart shows, which is from a paper, which is a review paper in 2021, is the most important risk factor is still poor WASH. So in humanitarian crises, you have destruction of WASH infrastructure, such as sanitation, water, hand washing facilities, meaning the barrier between the transmission of fecal oral diseases is removed. So you get increased transmission and also you get increased exposure to fecal oral diseases. This is why outbreaks of fecal oral diseases are common in humanitarian settings. So before I go any further, I just want to do a terminology check. So an epidemic refers to an increase, often sudden, in the number of cases of a disease above what is normally expected in that population in that area. An outbreak carries the same definition as an epidemic, but is often used for a more limited geographic area, and a pandemic refers to an epidemic that is spread over several countries or continents, usually affecting a large number of people. So the difference in the terminology is really related to geography, but they're not very well defined. But what I'm going to say is in humanitarian contexts, we normally use the term outbreak because the geographical area is slightly more limited. So outbreaks result from several factors, such as an increase in the amount of pathogen, an introduction of the pathogen into the setting, enhanced modes of transition, a change in the susceptibility of the host's response to the pathogen. And the host is us, people that ingest the pathogen, and factors that increase the host's exposure. So how do these factors relate to the humanitarian context or setting? So an increase in the amount of pathogens. So the breakdown of sanitation infrastructure means more fecal oral pathogens are in the environment. An introduction of the pathogen into the setting. So we've got movement of people. People may introduce new pathogens to a community or an area. And also we have responders coming from all over the globe, and they may introduce new pathogens. So you may have heard of the cholera outbreak some years ago in Haiti, and the cholera strain was actually brought in with the responders. We've got enhanced modes of transmission. So we've got poor hygiene, we've got a lack of safe excreta management, and we've got contamination of drinking water. We've got a population that is malnourished, stressed, and traumatized. So they will have a lower immunity, so they'll be more susceptible to the pathogen and more likely to develop symptoms. And we have factors that increase the host's exposure. So normally within humanitarian settings, we have an increase in population density, so people are closer together. And we also have a lack of WASH infrastructure. So this table is from a systematic review that looked at the response to different outbreaks in humanitarian and low-income settings over a 10-year period. And what you can see in this table is that cholera nearly accounted for half of the outbreaks globally during this period. Currently, there are 21 outbreaks of cholera worldwide in 21 different countries. This is from the Global Cholera and Acute Watery Diarrhea dashboard, which is kept updated by the WHO. And I just wanted to share this article with you, which was from a UK newspaper from about 2 weeks ago, where they've noted that the number of cholera cases has been increasing since 2021 globally. And they put this down to dirty water, so it's related to WASH, it's related to man-made disasters, endless wars, and they also attribute it to climate change, which is related to natural disasters. So that was data from low income and humanitarian contexts, whereas this data is from refugee camps. It was taken from a paper which reviewed outbreaks in refugee camps from 2009 to 2017. And again, what you can see here is that cholera has the second highest frequency of outbreaks and the third highest number of cases. The fourth highest number of cases is watery diarrhea. Sorry. When we look at a list of the diseases which cause outbreaks in refugee camps, nearly half of them, which are related to fecal oral diseases, and these are the ones that I've highlighted in yellow. And you can see the transmission routes here, fecal oral. This is why restoring WASH is so important during humanitarian crises. We need to reinstall the WASH barriers to fecal oral diseases to stop transmission. So sanitation, hygiene, and water. But during an outbreak, you may want to target your interventions, perhaps due to funding constraints or particularly vulnerable populations. This is when you might use epidemiological data, and you might need to analyze this. So epidemiology is a branch of public health which enables you to answer the following questions. Who has the disease or who is sick? When did they get it? Where is the affected population? How many people affected? Why have they been affected? How did they contract the disease? How can it be prevented? This knowledge, together with knowledge of the pathogen causing disease, will enable you to develop and deliver targeted, effective responses. The WASH sector doesn't do this work alone. You'll need to work with the health sector. They collect data on notifiable diseases such as hepatitis A, hepatitis E, and cholera. And during a humanitarian crisis, this type of monitoring is established or strengthened. And there's a lot of guidance out there from the WHO. You can see here, this is a page from the WHO on the early warning, alert and response system, which gives you guidance in how to put one of these, or how to put these kinds of systems in place. In the course that I run, we look at interpreting this data to design targeted, appropriate interventions to an outbreak. We use a real life case study, and this is actually basically the assignment that runs throughout the course. This is an example of the data collected. It's taken from the epidemiological highlights at Cox's Bazar. You can see that they record the number of suspected cases of acute watery diarrhea. They look at the confirmed number of cases, and you'll also see they map the cases on the, they map out the cases on a map so you can identify hotspots. WASH interventions across the phases of a humanitarian response are very different. You have 3 phases in humanitarian response, and they're related to the disaster management cycle. You have the acute, the stabilization, and the recovery stage, and it kind of, this is where you're phasing from humanitarian into the development sector, or development rather than humanitarian. So across the different phases, and just give you an overview of the different phases, you've got the immediate response in the first few hours to the first few weeks. This is when you have short-term measures in place and you do easy rehabilitation. You've got stabilization. This is the first few weeks to first few years, where you're trying to increase coverage. You're doing incremental upgrades. You're looking at long-term solutions, and you're moving towards development. And in recovery, which ranges from the first 6 months to 3 years, you're looking at restoring services to the pre-emergency state or improved. So we would say build back better. You move towards development principles, and you build in preparedness and resilience into the services. When we think about this across the different aspects of WASH, water, sanitation, and hygiene, it looks very similar. So these are the kinds of activities that you'll be doing across the different stages. And so in the acute stage for water, you'll look at a rapid assessment of situation and needs. You'll look at clean water provision. You might tanker in water, it might be bottled water. There's prevention of contamination, so you might be giving out chlorine tablets. There's quick rehabilitation of existing water supplies. You might chlorinate wells. During the stabilization phase, you might increase service, you'll increase service coverage, you'll improve temporary systems, and you're looking towards sustainability. During the recovery phase, you're looking at restoring the infrastructure and the services to the pre-emergency stage or better. You're moving towards development principles, and you're building in preparedness and resilience. When we talk about sanitation, it's very similar. So there's a rapid assessment of situation and needs during the acute phase. There's easy rehabilitation. And then here you're very much focusing on the safe excreta containment. so making sure there's the barrier between people and feces. Easy treatment solutions such as lime, and safe disposal such as burial traps, outfalls. During the stabilization phase, you're looking at the replacement of temporary structures, increasing coverage, incremental upgrades, long-term solutions, and you're probably phasing between shared sanitation to household sanitation in camps. Again, you're looking at systems and sustainability. And then the recovery phase is very similar as in the points for water. So we're looking at developing the systems to their pre-emergency state or building back better, moving towards development principles and building in preparedness and resilience. Within hygiene, again, we've got this rapid needs assessment. In the acute phase, we'll be giving the population access to hygiene items such as soap, menstrual hygiene products, incontinence pads, and carrying out hygiene campaigns. During the stabilization phase, there's more in-depth assessment, monitoring of the initial interventions, increase in infrastructure and incremental upgrades. And then during the recovery phase, we'll be looking at more development approaches, market-based approaches, and promoting gender and human rights and long-term capacity development. So the focus of this keynote has been on communicable disease prevention and WASH, but public health is not just the absence of diseases. It's also a state of complete physical, mental, and social well-being. And I think we've all heard this saying before, water is life, but sanitation is dignity. The diagram on this slide shows a link between sanitation and well-being. Poor sanitation reduces human well-being, social and economic development due to impacts such as anxiety, risk of sexual assault, and loss of opportunities for education and work. So WASH impacts public health across multiple dimensions. Hence, WASH is always and will always be a critical component of public health. And this component is absolutely critical in humanitarian responses. This is the end of the keynote, which I've covered some of the basic principles that we cover in the public and environmental health course in emergencies. So this is, and I've also spoken a little bit about how some of the other topics and themes that I've briefly introduced are covered in more detail in the course. So thank you very much for your time and listening to me. And I don't know if to open the floor for any questions or whether you'll do that, Tineke. So I'm going to stop sharing. Is that right?
Okay, thank you very much, Claire. And before indeed we come to questions to the GPDP, maybe there are some questions for Claire.
I will try and answer them.
Yeah. So I don't see any hands raised.
Tineke, you can use the chat and see the questions, and
I can hear you.
You can use the chat box and see the questions. You can pick yourself, and maybe
Okay.
Ticia or Claire can answer them.
Okay, perfect.
Yeah.
Okay. Oh, I have to change the view. Or is the chat box?
I think most of the questions are related to the course.
Exactly. I don't see new. Okay, maybe there are some new questions coming. Would decentralized wastewater treatment be something that WASH might consider?
Okay, so yes. So in lots of these camps, especially larger camps such as Cox's Bazar, well, when you say decentralized wastewater treatment, are you talking about sewer sanitation?
Abdullah Khan, can you maybe clarify that in the chat? decentralized wastewater treatment, are you thinking about sewer sanitation or non-sewer sanitation?
So lots of the camps have water distribution systems, so they have pipes and things like that. So they do have like a piped water supply in lots of places. Obviously, if you're talking about urban contexts, then there's a rehabilitation of the sewer network.
Sorry, Claire, Abdullah said I'm especially interested in rural and peri-urban areas.
Okay, so in a humanitarian crisis that affects a rural area, people will probably be having on-site sanitation systems. So it won't be sewered, and so they will probably be reliant on what's decentralized water treatment plant? Yeah. So they'll probably be reliant on pit latrines. In peri-urban areas, they will probably be reliant on on-site sanitation systems, but perhaps those sanitation systems are emptied and that waste is treated in a decentralized plant. Some of the larger camps, like in Cox's Bazar, they have decentralized treatment of fecal sludge. So they have many different types of decentralized treatment plants in the camps, and there's like more than one treatment plant in each camp. So there's lots of these decentralized systems that are used to treat fecal sludge in emergencies, mainly in camp settings, I would say. I hope that answers your question.
Okay, yes, I think Abdullah says, thank you, was very informative. There is also a question on, not specific for Claire, but Ticha's already answering. That was the duration of the course. So per course, it's about 16 weeks. And 8 hours per week, is roughly the time needed to spend on the course. Okay, I think all the other chat's questions were answered during the presentation of me and of Claire. So I don't see any new questions popping up. Okay, I hope we have been informative and that everything was clear. If not, please reach out to us. You can find us on IHE websites. Okay, before closing, there is another question from Abdul. Is there any standard method for the disposal of feces from cholera patients?
So there's lots of recommendations for the WHO, and especially, I think if you're talking about patients, you're talking about healthcare facilities and disposing of waste from the healthcare facilities. One of the standard treatments is lime treatment for that kind of waste. But I think if you look at the resources that are available, there's lots of information out there about WASH in healthcare facilities and cholera treatment centres. This is one of the things that I think is really nice about the course, is there are so many really good resources out there that this course introduces you to these different resources that you can then go on to use in your work.
Okay, there's a question from Dafala. Can you share us the material? So we will put this presentation, this webinar on the website. So when you go to IHE website, you can find it, and you can also find the webinar from last year, in which Shira Singh gave a very nice introductory to the course on urban water and sanitation. So you can also view that one.
So on the YouTube channel, exactly, not on the website, but we put on the YouTube channel of IHE.
Oh, okay, on YouTube.
Yeah,
I also saw, okay, but the presentation from last year, I also saw on the IHE website under the GPDP. Maybe it was just a link to the YouTube channel there then.
Yeah.
Okay, thank you for
no problem
for the clarification. And there's a question, are there any statistics or could you guide on who are most affected by crisis in relation to WASH aspects?
So I think this is related to the kinds of disease outbreak and the context. So if you're looking at targeting, it's very dependent on the disease itself and the context and the conditions that people have in humanitarian crises. So I can't give you general guidance, but there are basically groups that are more susceptible to different diseases. And that's quite well known. Perhaps the WHO sanitation guidelines, I think, has a chapter on different pathogens, and there's lots of information out there that you can just Google.
Okay, thank you, Claire. Yeah, there's still some further questions on the scholarships. There are IHE doesn't have scholarships for this course. I advise you to contact your organization. They might have some scholarships. We've seen that before, especially with the larger organizations who have funding for training for their staff. When you're not working for such an organization, we realize it is difficult because the courses are relatively expensive, not expensive when you compare them with other courses in Europe, but still, indeed, they cost quite some money. So that I realized that constraint. There is a question on, do we get the lecture notes for today's class? I think what we have the webinar with the presentation, maybe we can also put the presentation as such there, but at least you can always look it back on the YouTube channel, so you can have a look again at the presentation. Let me see if there's some other questions popping up. I don't see anything. Well, you can always reach out to us, like I mentioned before. Well, there is again a question from Abdullah. Would the means of innovating home farm sets be a possible way of limiting disease outbreaks? I think that is for when you have really homes and private sanitation facilities.
So I'm not quite sure because it's quite a difficult. So a home faucet would be, I would assume, like a tap. And the issue is the quality of the water that comes out of the tap, especially depending on if it's chlorinated or not and what kind of outbreak it is. So even if you had a household water supply with taps, it doesn't mean that especially in a humanitarian crisis where you've got perhaps a natural disaster, you might have fracturing of the pipes bringing the water to the households, and then you would get contaminated water, and you might get disease outbreaks from that. So you would still need household treatment. So this is probably more related to urban contexts. So you might need household treatment. People might distribute bottled water. Things like that might occur during the acute phase of a humanitarian crisis.
Okay, Claire. Then there is a question on the cost, any possibility for exemptions on the courses? So with decentralized water and sanitation as part of this diploma, well, it is not really part, and for exemptions we have to ask the examination board to see if that can be if that's possible. But the aim of these courses, or the focus, is all on humanitarian context. And these are the only 4 courses on humanitarian context that we run at IHE, and therefore it's also like one package, one diploma. So I don't think that any other course can be used as an exemption for the GPDP. But to be sure, your request, when you have a specific request mailed to Titia, we have to ask the examination board to see how far that can be exempted. I have a request to show us into the IHE Delft platform for new students. Today, I created an account, but I was unable to sign in due issues with the template and the password reset system. Okay, so Titia said, please send me an email, and then Titia can answer that very specific question later today. Okay, I don't see. Okay, we're also running out of time now, or not really running, but almost. The 1 hour is almost, done. Thank you all very much for your presence, and also IHE staff that helped to set up this webinar. And also the module coordinator, the course coordinators that are here with us, and especially Claire to give this very nice teaser of your course. Thank you very much, and all the participants. I'm so happy that you were here with us. I hope it was interesting and that you got an idea of what you can expect for the GPDP. Thank you so much.
Goodbye.
Bye-bye.
Bye.